patients were considered subjects. You were a number in a research project. That started to change when some smart people realized that patients actually also have brains and not only that, have experience that nobody else has.
I've been a patient partner since 2017, and I got involved with Can-SOLVE because I wanted to improve my life and improve the lives of other patients with CKD. I wanted to be involved in something like bigger than myself.
I chose to be a patient partner for my husband. He passed away 3 years ago, and during his journey I always said if there was anything that I could ever do to use my voice to make it better for somebody else, that's what I was going to do. You know, to honor him and to make sure that, you know, that nobody else ever has to go through the loss that I suffered.
At the very beginning, I think I was curious to find out what this was all about. And I wanted to know if I had the skills and experiences necessary to be able to do something like this. And I was also very curious as to if researchers would be interested in working with patients.
The comfort amongst health professionals to have patients a part of the activities, the planning, everything has really changed. Now I think all those barriers are gone, and the researchers and health professionals have really seen the value, the tremendous value.
Patients and their families have incredible amount of information and knowledge that we sometimes don't see or can see in a clinic setting.
They ask questions that sometimes they're questions that we think are self-evident, and it turns out they're not. And so I think they really enrich the way the project's developed, but also you know, the way that we move forward and the questions we ask.
Some of the very common symptoms that they experience on a day-to-day basis, whether it's itching or fatigue or weakness, and a lot of these symptoms for which we don't have good answers or good strategies to help them manage. So there's been many aha moments when it's like, why haven't we focused on this and why don't we have those answers? So it's understanding what's important to the patients and how we can really help them better manage their disease conditions.
In our Indigenous communities, there's such a high rate of not only kidney disease but also diabetes, and so to me that's what motivates me to do this work.
As an Indigenous person, bringing relationship building to the process and asking researchers, so what are you doing to make sure that you are your research participants are going to be of Indigenous descent? What are you doing?
People need to understand our histories, need to understand like our cultures and our lifestyles. So for me, I've been able to help bring some of those things that I've experienced and I've learned, and I can bring those to the network and help people to understand things from an Indigenous perspective and bring that perspective.
If we're working in kidney disease and we're not accessing Indigenous communities and Indigenous healthcare providers, then the whole, like what is the value of your study?
All patient partners, regardless how experienced they are, really have something to offer to the research experience or the research process.
Everyone has their strengths and has their own perspective, and the product is much richer when you have all those perspectives being considered.
We're building relationships between patients and caregivers and renal specialists and researchers, and building the relationship and building the trust is the most important part of any type of a project.
Nobody's expecting patients to become researchers, and they aren't expecting them to become nephrologists either. What is required for a patient is to be curious, is to want to learn.
Ask lots of questions, get involved, don't be afraid to use your voice. Express what you want to do, because they're there to support you every step of the way.
It's changed the way that I do research. It used to be the researcher thought this is the most important question and we'll do it and we'll publish it and that's the end. And we've come to appreciate that. Really focusing on the priority of patients is the optimal way to do research.
You know, Can-SOLVE has given me my voice. IPERC has given me my voice, and I think that people really need to tell their stories and really need to feel that they're being heard.